Hi, and welcome to the MCTC pre-admission conference for the LPN to RN hybrid program that's offered at the Maysville campus, the main campus in Maysville, Kentucky. We're so glad you decided to join us today. Again, welcome to the LPN to RN pre-admission conference for MCTC. My name is Ginger Clark, and I'm the Associate Dean of Health Sciences and the Nursing Program Administrator for Maysville Community Technical College. I have placed my phone number and extension along with my email address if you need to contact me for any reason. Usually the easiest way is to send an email to me, and I will get back to you as soon as I can. If you need anything else, there'll be some other contact information at the end of this slide presentation. So this slide talks about the topics we're going to discuss in this presentation, and that includes the introduction, the application process to the MCTC ADN program, philosophy of the ADN program, where to find the application packet, how to complete the packet, specific program requirements for the RN program, so the selective admission process, health screening requirements, criminal background checks that have to be completed, the deadline for application for the LPN to RN, which is the last business day in October, and the notification of acceptance to the RN program. So this slide is regarding the application process and where do I find the application. You are right close to it now that you're watching this pre-admission conference video, but if you go to the MCTC website and look right under the pre-admission conference for LPN to RN, you'll see a designation that says admissions info packet and one that says admissions signatures. So the admission info packet, if you click on that, will give you all the information that you need to read over, look over, make sure that you completely understand. And the admissions signatures are the forms that you need to sign, fill out, and send back to us at the college. So again, that's right below the pre-admission conference for LPN to RN. It will say admissions info packet and it will say admissions signatures. How do I complete the application? Again, you will watch this pre-admission conference. You will read the admission information packet. You do not need to send those forms in. You need to send the admission signatures forms in, all that are on that tab, and they all have blue at the top. So that tells you those are the ones that you need to make sure that you have filled out correctly and sent back to us at the college. Applications must be submitted by the deadline to be considered. Incomplete applications will not be considered. What would be considered an incomplete application? That would be if you didn't give us a correct phone number, a correct address, a correct email address so that we can contact you if we have any questions. If you leave forms out, that's incomplete. So you need to double check, triple check yourself that everything is complete. It's your responsibility to ensure that the application is complete and on file by the deadline. You have to mail in your application to the main Maysville campus. You cannot overnight or send it special mail. So overnight would be, or special mail usually will come to our loading dock, and if it requires a signature or anything like that, usually no one's there at the loading dock, so they take it back to the post office and then don't deliver it to us. So it wouldn't be there possibly on the deadline. So you're either better to bring it in yourself personally or to just mail it regular mail so that it comes to us. You can address it to Ginger Clark at MCTC, and the address is 1755 US 68, Maysville, Kentucky 41056. Or you can address it to the division assistant, and her name is Kathy Nelson, and it's the same address. Please do not send it electronically to us because we can't accept that. We have to have your signatures on those forms, so we can't accept electronic application. The LPN to RN deadline for application is the last business day in October. which is the last Friday in October. Application to the MCTC nursing program does not guarantee admission into the nursing program. We have a selective admission process that we'll discuss for admission consideration, but you're not guaranteed an admission just because you apply. Students will be notified via their KCTCS emails if they're accepted or denied admission into the program. This is the philosophy of the MCTC ADN program, so I'm going to give you a few minutes to look this over. So the next form in your application packet is your estimated program fees. So since you all are considered advanced standing, you won't have to take in Nursing 101. So that saves you 9 credit hours, but you will, the second semester, you will take 10 credit hours. So if you do the math, 182 times 10, you can figure out your cost for that. You also have some smart fees, textbook fees, the nurse kit, which is your supplies for the lab, your ATI access per semester is about $500. You have your uniform cost. You have to purchase those at the bookstore because we do have a monogrammed label on our uniforms that's for MCTC. Required before clinical rotations, Castle Branch, which is your background check, jug screen, plus a subscription and compliance tracker. You'll have to do immunization and blood work. Liability insurance per semester, you pay that with your tuition bill. You also have to purchase a stethoscope. The cost is $25. My recommendation is that you pay for a good stethoscope. That doesn't mean a $200 stethoscope. The one I have is about $35. But I've had students in the past who paid $4 for their stethoscope and it doesn't work and they can't hear breath sounds, lung sounds, heart sounds. So I would recommend that you buy a pretty good one. You need a watch with a second hand, a blood pressure cuff, and scissors. And then graduation expenses, they have your NCLEX approximation cost, cap, gown, tassels, and diploma cover fee. Graduation pictures are optional, and then your nursing pin, which is also optional. Other things could be your student nurse organization, and then clinical sites are listed there. There are the places that we most commonly go for clinical sites. So you need to be aware that if, let's say we go to Meadowview Regional Medical Center and you're on the do not hire list, they may deny you being able to do clinicals there. So that's a thing to consider. So the required documentation that you need to bring or include in your packet is, if you're still on the Nurse Aid Abuse Registry certification, if you've not let that go, please include a copy of that with your admission packet. Also, I would like a copy of the LPN unencumbered license. You will turn that in with your license application. You can go to the KBN website and just print that off. We need to have a copy of your CPR certification or recertification. You'll bring that to the first day of orientation. And you need to make sure that it's a provider that gives for CPR, such as American Heart, that gives training on infant, child, and adult CPR with AED. If you have a CPR card that doesn't include AED and doesn't include infant and child, then you will have to get that. prior to the first day of class. So please make sure that you work on that. The college does offer CPR classes, but you will need to get enrolled in those. Professional liability insurance proof, we actually give you insurance through your tuition, and you'll need proof that you've had a TB skin test. They will talk to you about all of that during orientation. Also, clinical facility requirements. These are possible things, a drug screen and criminal background check. You don't want to do these yourself. Castle Branch, who is our record repository company, will conduct these. You will have to have that. You will sign up to do those things during your orientation. But I will tell you that sometimes a facility may require, if it's over a year, that you have it again. So you may be required to do a drug screen and background check prior to your last semester of school. You also have to have a rubella titer, varicella immunization record or titer, mumps immunization record or titer, hepatitis B surface antigen, HB-sAg, which is usually a series of 3 shots, or an acute hepatitis panel, a respiratory fit test, and a test for PPD or chest x-ray. So those are things that we will tell you that you will be needing, and you have to put that into the Castle Branch to be able to go to clinical, so you can start collecting that information now, and we will put that in your file. Thank you. So you can find this form in your admission packet, and this basically just gives you some information about the program, some unique requirements that we've talked about, having your being on the nurse aid abuse registry, having your CPR that's a healthcare provider, etc. Taking the TEAS exam, which we're going to talk about. But we have changed some things this year. We changed the Senate rules for application into our program, and some of those include that you have to have Bio 137 and 139 prior to going into Nursing 101. So 139 has to be completed with a C or higher prior to beginning Nursing 101, which for the LPN to RN, of course, you get to miss the fundamentals, but it does have to be completed. They also have to be completed within the last 5 years of you starting your med-surg class in January. So if you have not completed 137 and 139, if it's been longer than 5 years, then you probably need to talk to an advisor about getting into those and maybe applying next year, just because we have not had success with students who have taken 137 and 139 10 years ago, 15 years ago. It really does hurt them as they go through, because we expect you to know all of the anatomy and physiology, and when you're kind of trying to learn that and this, it makes it more difficult. You also have to have Psych 110, of course, Math 150, which is college algebra. You have to have a C or higher. Your medical micro, a lot of people, if you have not taken it, take that in the summer in between their first year and second year. And of course, your English 101 you have to have, and a Heritage Humanities class. So that gives you some information. Like, again, you can look in your admission packet to get that information. The next form in your packet is the Registered Nursing Program Selective Admission Assessment. So basically what that means is we are a selective admissions program, meaning we have a selective number of slots that we have to fill, and that's dictated to us by the Kentucky Board of Nursing. So usually we always have more applicants than spaces. So we have a selective admissions process, and the people that are on that committee for the selective admissions are the people assigned by our president to sit on this committee and decide, going through each applicant's information. We figure out points to see how many points the student has, and then we decide who's going to be admitted due to the number of those points. And this makes it fair, meaning that not just one person is deciding, or you're not deciding because this is a friend of a friend. It's simply we go on points, how many points someone has, and how, what their grades are. If for some reason there's a tie, then we look at their GPA as the deciding factor for that. So if you look up in Area 1 first, it talks about your previous college experience. So we give you points for taking Bio 137, you get 2 points. 139, you get 2 points, and so on. And so you could get a total of 14 points at this part. So we only look at grades that are in PeopleSoft, or classes that are in PeopleSoft. So we can look at transfer grades, but if you haven't transferred things in, put your transfer or your transcripts in PeopleSoft through the admissions and registrar, then we can't look at those. We can't take an unofficial transcript that you've sent over through the email or anything. Area 2 are grades achieved in biology and math courses. So if you get an A or a B in 137, 139, Math 150, or Bio 225, which is micro, then you can get 8 points for an A, 4 points for a B in each of those classes. But I want you to notice under there it says we only look at the first 2 attempts. So if you've taken Bio 137 5 times, you get an A the last time. The 5th time, we don't look at that. We only look at the first 2 attempts and give you the highest grade of those 2. So we add those points and we put it down at the bottom in section 2, and you have the area points for section 1, area points for section 2. Then we look at your college GPA and courses completed at MCT and work experience. So the prerequisite is that you have to have a GPA of 2.5 to apply to the nursing program. And if you have a GPA above a 3.0 up to a 4.0, you can see you get from 12 to 18 points for that. If you have taken all of your courses at MCTC, which is any of the 4 campuses of Maysville Community and Technical College, you can get an additional 19 points for that. And that's not to punish anyone who's gone anywhere else, but it's also a way to reward the students that have been loyal to MCTC, and so they can get 19 points for that. And then we have the work and clinical experience. If you fill out the form in your admission packet that talks about healthcare experience from your work that you're currently working on, then you can get 2 points for that. I will also say for the LPN to RN, it's important that you know that our admission rules for KCTCS is that you have worked actively in the field as an LPN at the bedside for at least 1 year in the past 3 years. So that is to make sure if we're letting you skip the fundamentals class that you're current. If you just recently graduated, we know that you've been in school and you've learned those things, so that's fine. But if you've been out and working as an LPN, then we do need to make sure that you have the bedside experience. So it's 1 year in the past 3 years. I've had people come and talk to me and say, well, I haven't worked at the bedside for 15 years. Then truly you need to come back and start in the RN program at the fundamentals level, because a lot of those skills are forgotten. So we look at that, and then we look at your TEAS examination. That's area 4, and you can score between 0 and 15 points for the TEAS examination. So you have basic, you won't get any points if you score a 41.3 to a 58.6, all the way up to exemplary, and that's if you score a 90.7 or higher. If you score below a 41.3, we will not consider you for the program. You can retake it one time. We're going to talk about the TEAS on a different slide so that you can see that. But we take all of those areas, 1, 2, 3, and 4, we add them up, and then we see what your total points are at that point. You also have to have an LPN license that is unencumbered. So that means that you don't have any problems with the Board of Nursing or anything like that. So this slide talks about taking the TEAS examination. You can find this information in your admission packet. But the big thing is that the T's is our part of our points, as I discussed before, for the selective admission process. And T stands for the Test of Essential Academic Skills. It's much like an ACT. It's just for healthcare professionals. It's part of a national exam, and it's designated specifically to assess the student's academic preparedness. And the test is multiple choice, and the skills assessed are in mathematics, reading, science, English, and language usage. So I have given you on this slide, and it's on the website, the ATI testing link that gives you some information on how to study at home. I know I would have to study at home because I haven't taken a test like this in a long time, so I would want to be prepared. There's some free webinars, different things like that. The library has books you can check out for it. Also required that you take this test. It is required that you take it before the application deadline, which again is the end of last business day in October. The required score to be considered for the ADN program, the minimum is a 41.3, and again it goes up from there. You won't get any points for a 41.3 to a 58.6 because that's basic. If you score below a 41.3, ATI considers you in the developmental area. So you should take it again if you can. You can take it one time per admission cycle, one extra time. So you can take it twice per admission cycle. So if you score below a 41.3, I would study a little more and then retake it. You have to schedule with the testing center to do this. The information is again on the website under MCTC and under nursing for the testing center and how to sign up for the taking the TEAS examination. It is a cost that you will incur. It's about $65 for the test, or $69, and then you have to pay a $10 fee for a proctorio to be your proctoring system. Okay, thank you. So the next form included in your packet is a statement of understanding. This form will have to be returned with your admission packet to the college. And it says, as a student of this program, I agree to the rules, regulations, policies, and procedures as stated below. The program requires a period of assigned guided clinical experiences, either at the college or other appropriate facility in the community. For educational purposes and practice on live models, I will allow other students to practice procedures on me, and I will practice procedures on them under the guidance and direct supervision of my instructor. The nature and educational objectives of these procedures have been fully explained to me. No guarantee or assurances have been given to me by any representative of the college as to any problem that might be incurred as a result of these procedures. So usually you have lab partners that you practice head-to-toe assessments on. You practice listening to heart sounds, lung sounds, bowel sounds, different things like that. So that it gives you a much better way to practice than listening on a mannequin. These clinical experiences are assigned by the instructor for their educational value, and thus no payments or wages will be earned or expected. It is understood I will be a student within the clinical facilities that affiliate with my college and will conduct myself accordingly. I will follow all required and published personnel policies, standards, philosophy, and procedures of these agencies. I will agree at my own expense to obtain all health screenings, immunizations, criminal background checks, and drug screenings as required by the affiliating agency. I have been provided a copy of and read and agree to adhere to the college policies, rules, and regulations related to the program for which I am applying. I understand that information regarding patient or former patients is confidential and may be used only for clinical purposes within an educational setting according to the Health Insurance Portability and Accountability Act of 1996, or HIPAA. I understand that the educational experiences and knowledge gained during the program do not entitle me to a job. However, if all educational objectives and licensure requirements are successfully obtained, I will be qualified for a job in this occupation. I understand that any action on my part inconsistent with the above understandings may result in suspension of training. I understand that I am liable for my own medical and hospital expenses, and I understand that I am accountable for my own actions. Therefore, I will carry the minimum liability insurance, which again is in your tuition cost each semester, the facility. So you say, I have read and understand each term above and agree to abide by this statement of understanding, and you sign it and date it, and you'll return that with your admission packet. Now, to go into a little more depth of some of these, I will say number 4, it says that you understand that you're a student within the clinical facilities that affiliate with the college. If you look on the previous sheet that gave you some of the examples of places we go, if a facility refuses you admittance into their clinical setting for some reason, if you were fired from that facility, we will try to find another facility. But if we don't go to another facility, then that may exclude you from the program. When you talk about adhering to the college's policies, rules, and regulations, we give you a student handbook at the beginning of the nursing program, and that is your Bible basically for the program. It tells you about uniforms, what you have to be, what you have to wear to clinical facilities, about professionalism, and we are very strong on you following those rules. If for some reason you come to a clinical setting and you are out of uniform for some reason, you wore purple shoes, you wore your hair, you have 15 earrings in and your tongue is pierced. If you have not taken those things out for the clinical setting, you can be sent home and given an unsatisfactory for that. We're very strict on the rules. I am the first person that a facility will usually contact to say, why is your student out of uniform? If you have tattoos, they have to be covered. Why is your student having tattoos? If our facility says you can't do that, that our own staff can't do that, then why should your students be able to do that? And they know who our students are, those facilities. You guys are all in the same colors. And if I get that call and I have to call the clinical instructor and say who's out of uniform, who's wearing jewelry, who's wearing a tongue ring, etc., you will be sent home and you will be given an unsatisfactory. If you get 3 unsatisfactories, again, you are out of the program. So we follow those rules not just because we like to write rules. Those came from the facilities. We have long-standing relationships with the facilities we go to, and it's not fair for students to be out of the conformed uniform that their staff have to be in. So yes, our restrictions are strict. We expect you to follow them. I don't care what you do when you're working on your own time, but when you're in a facility and you're representing the college and you're representing the nursing program, we expect you to adhere to all uniform requirements. We expect you to act professionally at all times, have your badge on at all times if you're representing the college. And so those are things that you want to definitely be aware of and know that we are very strict on that. HIPAA is another thing that we are very concerned about. Breaking HIPAA can result in a huge fine for students, up to $250,000 of your money. It wouldn't be covered under the liability insurance. So we all live in small towns. MCTC is basically every campus is in a small rural area and everybody knows everybody. So we take this very seriously, and you do not want to talk about a patient that you are caring for at any time anywhere outside of the setting of the hospital to your instructor or to the nurse caring for them. You don't even want to discuss it between each other. You don't want to discuss it at the lunch table, what you did to Mr. So-and-so in room 239A, because their family may be sitting there and know exactly who you're talking about. And the hospital can find out that you broke HIPAA and they can call us, and they can refuse to allow you back into the facility, which basically means that you would be out of the program. So we take HIPAA very seriously, and you don't want to put anything on social media. You don't want to put anything out there that would in any way jeopardize your admission into the program, or the possibility of being fined federally for breaking HIPAA confidence. The next form in your packet is technical standards. So it says nursing at the technical level involves the provisions of direct care for individuals and is characterized by the application of verified knowledge in the skillful performance of nursing functions. Therefore, in order to be retained in the program, all applicants should possess 1, sufficient visual acuity such as needed in the preparation and administration of medications and for the observation necessary for patient assessment and nursing care. So that means that you have to be able to see adequately to draw up medications in a syringe, that you can read that syringe in those tiny numbers, or it can be corrected with glasses. 2, sufficient auditory perception to receive verbal communication from patients and members of the healthcare team, and to assess health needs in people through the use of monitoring devices such as cardiac monitors, stethoscopes, IV infusion pumps, dot tones, fire alarms, etc. 3, sufficient gross and fine motor coordination to respond promptly and to implement the skills, including the manipulation of equipment required in meeting health needs. So you have to be able to support a patient, carry a patient if they fall, help lift a patient, and also have fine motor coordination, again, to draw up syringes, different things like that. 4, sufficient communication skills, speech, reading, writing, to interact with individuals and to communicate their needs promptly and effectively as may be necessary in the individual's interests. Sufficient intellectual and emotional functions to plan and implement care for individuals. So this form again needs to be signed and returned to the main campus with your admission packets. And it has, if you need any special accommodations, that you contact myself or Lori Gantz at the registrars or admissions department. This form in your packet is the student data form. So it has your personal information, and one of the things that we do ask about is that English is your second language, and then your race and ethnicity. We need this for our KBN benchmark reporting, so if you will please fill that out for sure. We also need to make sure that you have a good phone number and a good KCTCS email. We need to be able to contact you in the way that you're contacted if you are admitted into the program is through email. So please make sure that it's a good email contact for us, that you have a good phone number. We also need your emergency contact information, and then the appropriate response for if you're a new student, if you're an LPN to RN, or readmission student. Thank you. The next form that we're going to talk about is the KBN, or Kentucky Board of Nursing Crime Conviction Procedure Acknowledgement. And before we get to this form, I want to make sure that you see that you need to read the KBN Criminal Conviction Brochure in the admission packet. This is a form that answers a lot of questions, the brochure does. It also has the Kentucky Board of Nursing phone number that you can contact them if you have any questions about your criminal background or your criminal background check. The Kentucky Board of Nursing has the right to deny you the ability to sit for the national testing or the NCLEX because of things that might be on your criminal background check. So I can't answer those questions. The Kentucky Board of Nursing can answer those questions for you. Kentucky Board of Nursing does have mandatory reporting of all criminal convictions. So even when I renew my license every year, I have to check that I haven't had any misdemeanors or other crimes on my background. If I fail to do that, they could either fine me or suspend my nursing license if I lie and think, oh, they won't find out. And the criminal background checks for students before sitting for the NCLEX actually go through the FBI. So you want to be honest. I've heard of students who have lied, been allowed to test, but as soon as they passed, they got their licensure, but they also got a huge fine from the Kentucky Board of Nursing. So it's not something that you want to mess around with when you are looking at that. Again, I can't answer those questions. You need to call the Kentucky Board of Nursing. But this KBN conviction procedure acknowledgement says the KBN requires that all prospective nursing students and or enrolled nursing students be aware of the established procedures an individual must complete if he or she has been convicted of a crime. This includes felony and misdemeanors, except traffic violations. The following must be completed. An individual may write a letter to the executive director of the Board of Nursing requesting a hearing and explaining the circumstances of a crime. B, request that official copies of the charges, conviction, and penalty be sent to the executive director of the Board of Nursing and submit additional information as requested. Number 2, a hearing will be scheduled if the charges were of such nature as to be related to the occupation of nursing, or B, if the penalty imposed has been fulfilled. A hearing will not be scheduled for an individual on parole or probation. 3, the Board of Nursing will consider A, the nature of the offense and its relationship to the occupation of nursing, B, the activities of the individual since the crime was committed, and 4, the Board of Nursing will give reasonable assurance that A, the individual will not be permitted to take the state board test pool examination if he or she completes a nursing program, or B, the individual will be permitted to take the state board test pool examination if there are no further problems and the nursing program is successfully completed. So we need you to sign this paper and date it and return it with your admission packet. This form is our policy for readmission. So if you are considering trying to come back in because you were unsuccessful in one of our programs, you can look at this form and it's in your admission packet. And the big things that you have to do are submit a letter to myself to say why you want to be considered for readmitting into the program. You also have to get a faculty member to recommend that you be in the program, but you can read this in your packet and get further information. So the next form is the LPN to RN Advanced Placement Guidelines, and basically this says that you will be considered an advanced placement student if you've passed your NCLEX, you have an unrestricted, unencumbered license as an LPN. You will get to miss Nursing 101 or skip Nursing 101 because of your experience. But if you've graduated more than 3 years prior to admission into the program, we do require that you provide verification of current employment, and current employment is defined as 1 full year full-time employment as an LPN in the last 3 years, and the employment in nursing shall be defined as patient-client contact and shall be verified by the employing agency using the standard verification of employment form, which I have included in your signature packet. So please make sure you have a good contact so that we can call to verify that. So this form is the nursing care work experience documentation form. This is one of 2 forms that you have to sign, and it must be accompanied by a signature to be considered, again, like I said in the last slide, for advanced placement. So you would need to fill out your work experience as an LPN, your times that you worked, the number of days a week, etc. And then you have to have a signature from your employer. So this is mandatory. If it is not signed by an employer, we will not consider your application. So please make sure that you have this filled out. So this is the second form for verification of employment. So you need to put your license number on there that you, I, Ginger Clark, LPN, may be eligible to receive advanced standing. So that's where your signature goes. And then this is to confirm that you worked at your applicant name. Please print that. Was employed at the name of the agency from when to when for however many hours per week. Then you will initial that says, I understand that this will be verified. And then you have to have the signature at the bottom. It's not your signature. You signed at the top, but it's your employer's signature, their title and their date and the date. And we will get in contact with that person to verify that you have worked 1 year in the past 3 years. Before we wrap this up, I just want to talk about a couple things. I want you to remember that this is a hybrid program, and what that means is it is online for the lectures, but you do have to come in for clinicals, and you do have to come in for lab checkoffs. That's a requirement, and we try to tell you at the beginning of the semester when that'll be so you can schedule it around work. But this is a hard program, so just because it's online does not mean that it is a program that you can just quickly get through. We are required by the Kentucky Board of Nursing to make this just as rigorous as if you were face-to-face, and you do come in for testing with the rest of the class. Also, make sure that you study, make sure you purchase the correct books. If you get accepted, that you purchase the books that are required. Don't purchase used books until you talk to your faculty about that, because sometimes that gets people in trouble. They have spent all that money buying used books from previous students, but that's not the books that we use. So just some things to think about. I will say it is very difficult sometimes to work full-time and to go to school full-time, even if it is online. So those are just some things I want you to be aware of, and think, do I have the time to do this? Can I put in the work that needs to be completed? So in this slide, I just give people some information, some things to think about before you apply for the program, and think about, am I ready? Am I able to dedicate the amount of time and effort and everything else that is required to be in this program? Our LPN to RN program is considered a hybrid program. So what that means is, yes, your lectures and everything are online, but you have to come to clinical, you have to come to lab checkoffs. You can come in for practice for lab checkoffs before you actually do checkoff. And you also have to come in to take your examinations. You come in with the face-to-face students on the exam dates that they take their exams. You will be required to do the same. The next thing to think about is study time. Do I have enough time to study? This program is very rigorous, and the Kentucky Board of Nursing requires that we have the same rigors for the face-to-face students as we do for our hybrid online classes. So just because you become an LPN does not mean that you know everything. This is at a completely different level, and you have to be ready to study. You cannot think that I pass my LPN boards, I will pass nursing school, and I will pass the NCLEX RN. You have to be prepared to study, and study as much as you would face-to-face. You need to get on the computer every day. You need to listen to those lectures. You need to read the chapters and do all the things that you had to do in your LPN program to be ready for the RN program. The next thing I would tell you is make sure you purchase the correct books. Don't buy books off of a previous student, because number one, the ATI books, you have to have your own account. You have to purchase those yourself. So please don't buy those off a student and then think that you won't have to pay for it, because you will. Also, if you buy books that are older and we've updated to a new version, then it's not our responsibility to make sure that that is the same and compatible. So if you need to talk to your instructor to see what version they're using before you buy a book off of another past student. The next thing I want to tell you is that this program is very difficult. If you work full time, most of our students do not succeed. There are lots of scholarships out there, different things that you can do to assist you with paying for school. But the students that I see who come and work full time, especially during COVID, and work 6 12-hour shifts before they take a test, they're just not successful. And I hate to say that. I know we need nurses out there on the field working, but you need to realize that school is just as important as working, and you have to dedicate that time. If you work however many 12-hour shifts, especially night shift, and come in to take a test at 9 o'clock in the morning, your chances of passing are probably pretty slim. And you have to decide in your own heart, is this the right time for me to go to school? I want you to be successful. The faculty wants you to be successful, but most of the students who aren't successful say, I just have to work too much. So if you can't dedicate the time, please consider waiting and then coming back when you can. We love to have you. We want you, but we want to see you be successful. And you have to make sure you're ready for that with your family and your life situation. This slide is just to make sure that you include your printed copy of the online pre-admission conference verification form to say that you have watched this presentation, and make sure you send it with your application. The code for attending the pre-admission conference is MCTC LPN-RN 2021. So this slide is just some things to think about prior to sending everything in and your first day of class. One is you need to schedule a TEAS examination in the testing center at any MCTC campus. You need to fill out the proper paperwork in the admission packet marked with blue writing at the top and return that to the Maysville MCTC main campus. Do not send it via overnight shipping, needing a special signature or any special way, because it might not get delivered and it might be returned to you. And if that happens, you will miss the cutoff date or the application deadline, and you won't be considered for the program. You want to either bring it to the main campus or deliver it in the mail so that we get it on time. Remember, for advanced placement consideration, you must do skills checkoffs that are required for Nursing 101 prior to the first day of class. You'll make an appointment with the lab instructor to do these. Usually you pick out 5 skills out of a hat, and those are the ones that you get to do, but they can include NG tube placement, feeding, and med pass, complex dressing changes such as a wet to dry dressing change, oral medication pass, all injections, sub-Q, IM, IV, and IVs could be starting, hanging, primary bags and secondary bags, and mixing of insulins. I also recommend that you spend time refreshing on the nursing process and Maslow's hierarchy of needs prior to the first day of class, because you will be expected to be at the same place that you would be, that the nursing face-to-face class students are, and they've had an entire semester to practice this, take tests, and if you can't remember, you're doing a lot of catch-up. So over the holiday, I would recommend that you read your nursing process and your Maslow's hierarchy of needs, and even your ABCs. Look over an NCLEX review book so that you can remember how nursing questions are, so that you don't feel like you're running uphill to catch up with everybody. If you have any questions, please reach out to myself, our division assistant, or any of the nursing faculty, as we're here to help you make this a smooth process, and we want you to be as successful as possible. If you have any questions, I've included my phone number and this division assistant's phone number, Kathy Nelson. You can contact them, for either one of us, for any questions you may have.